There is no specific medication which can give you the terminal hair or terminal beard growth. This is the third mistake which people usually face after getting their beard transplantation done improperly. In this video, I'm going to talk about patchy beard issues and how you can fix this with a beard hair transplant. Hi everyone, I'm Dr. Asif from CARA Hair Transplant and Aesthetic Center. In this video, I'm going to talk about patchy beard issues and how you can fix this with a beard hair transplant. Definitely, as a man, beard is a sign of masculinity, and there are a lot of people who suffer from psychological stress because of having a patchy beard issues. Now they can definitely fix it, but before that I have to tell you a few things like how you have to get this done, what are the cautions you have to take while getting the beard transplantation performed, and what is the natural pattern of the beard. You should understand that also first, and you have to see how you can judge the proper natural looking beard hair transplant result. So this video will give a lot of insights about beard hair transplant, the process, and the cautions, do's and don'ts as well. So let's dive into the more detail. So let's start with the patchy beard issues and who are the ideal candidate for getting a beard hair transplant. So if we have crossed the age 20 years of your age, or 22 or 25, I'll keep it 25 in general if it is there, but you can get it done after 20 years age as well. Now the age is one parameter, but if you have entire beard which is like empty, you have to go for certain hormonal test first. So check your hormones, and you can come to us, you can come to your dermatologist, and they will evaluate certain hormones to see if there is any hormonal problems which has caused this issue to you. If they are somehow patchy, and which is very common in certain genetics, specifically if a person is from northern side of India as well as in certain parts of the world as well, where you genetically have a risk of having a patchy beard issues. In those cases, definitely genes plays a major role. So primarily it is genetic issues which can be a possible reason behind this. Sometimes there are medical conditions which can cause acquired hair loss. Let's say you had certain infection in the beard in certain areas, which is like a tinea barbi, which is one of the common cause for getting infection in the beard. That can also lead to some sort of hair loss, but not necessarily, because you can definitely fix that problem with medication. That's easily doable. So not every case need beard transplant. We need to see what is the cause of patchy beard issues. On that basis, the doctor has to take a call, like whether we need to fix this through surgery or by medication. In majority of the cases, people are usually aware of, because once they cross the puberty, their sexual life has started. All the developmental things, they are right in place, but somehow they have not developed any enough beard, and for that they are really concerned about it, face a lot of psychological stress, and they can fix this issue by getting the beard hair transplant. Age limit, I'll keep it 25, but you can get this in between 20 to 25 as well, depending on your requirement, and this is how it should be done. Anatomically, why it matters, so let's say on a top of the layer, which is a epidermis, and then below there is a dermis, and then there's a third layer which is known as subcute, and hair follicles are usually there in the subcute layer of the skin, and you have already been given a fixed number of hair follicles at birth, and once you cross a puberty, because of the androgens, the hormones, these hair roots, they develop from villus, which is like a baby hair, to terminal hair, the thick hair. That's how a beard is developed in normal circumstances. In certain situations, as I told you, in genetic reason or because of hormonal reasons, somehow the development is not being done, and all these hair follicles which are there, either they are not there at present because of the genetic causes, or if they are not developing because of the poor hormonal control. So these follicles are not becoming terminal in nature and by characteristics, and that time you suffer from patchy beard issues. So this is how a normal beard hair develops in a normal population, and how it can be differed with a patchy beard issue. issues. So either you are not having enough follicles which are not been there from the birth, or they are not developing because of the poor hormonal issues. So let's discuss about investigations. If there's any investigations required in case of patchy beard, in general it's not required until unless your doctor suspect that you have certain hormonal imbalances or hormonal issues where other sexual developmental issues are also present. In those situations, your doctor might ask you to go for certain hormonal tests. Otherwise, in general, there is no requirement of getting any blood test done to check for any patchy beard issues causes. Let's talk about the treatment part. Patchy beard issues, usually patients, they try first with the minoxidil. They apply that, and minoxidil definitely can give you some sort of fine hair growth, which will not be terminal hair. They will be very fine baby, as well as there will be, the color will be also be very light in appearance, plus the thickness will not be that great. So with minoxidil you can get some sort of relief, some sort of villous hair, baby hair, but they will fall once you start applying the minoxidil. So there is no specific medication which can give you the terminal hair or terminal beard growth. Also, majority of the time what I feel is people are not aware about what is the actual beard shape is. So before going for the beard hair transplantation, this is very important to understand, because majority of the transplant clinic, which personally I have seen their work, and when I saw them, the first mistake which they do is they are unable to create the proper natural beard shape, and the shape comes with the understanding how the beard is there, the natural beard. So let's talk about the component of the natural beard. It starts with the side lock first, which is the first portion, and this side lock portion there's a cheek line to it. The cheek line is directly comes over the top of the cheek, and it straight away it either merge with the mustache or there's a triangular gap. So in either way it looks natural, whether you keep a small triangular gap at the corner or you can directly merge your cheek line with the mustache region. Then there is a neckline, which is the end of the beard, which is the neck. So side lock, cheek line, and the neck line. There are three things which makes your the lateral boundaries of the beard. There is a posterior line as well where the beard ends posteriorly. So side lock, cheek line, neck line, and the posterior line make the entire beard for the one side, and the same goes for the other side as well. In between there is a beard body, the entire structure. Now there's a center part, which is exactly in the center, start from the mustache. There is a goatee and there is a chin area which has densely packed of hair. So this entire structure make all the areas covered, and it fulfills the requirement of a proper beard. In a natural beard, you have side locks, you got a cheek line, you got a neckline, you got a beard body, you got a mustache, goatee, and the chin area. The another variation is in the density of hair. The density is highly packed in the chin areas, mustache region. On the other hand, the neck is sparsely placed and the beard body has enough density to support. So there are some of the areas in beard which are strong in density, and there are some areas which are weak in density, and we have to respect when we are going to do the transplant. We cannot overly transplant in the neck region. We cannot poorly transplant hair in the chin areas, otherwise it would look patchy all the time. So these are the variations which should be remembered when you are getting your beard hair transplantation done. The second mistake which I saw in the repair surgeries, where the person has got the surgery done, even the shape was there, but they got a lot of multiple follicle graft in their beard, which 3 hairs together, 4 hairs together. Natural beard doesn't have 2 hair group or 3 hair group. They're usually singly placed. 95 to 97% of the hair should be single, and if there could be double hair as well, but they're limited to 2 to 3% only. So if you are getting a beard hair transplantation done, make sure that you should not get any double or 3 hair follicle implanted in your beard. Otherwise this will create a pluggy appearance, and there will be a lot of cobblestoning, which makes your beard predictable, as well as you won't be able to keep your beard too short, because every time when the light will come, you will see a lot of cobblestone or bumpy spaces on your beard. So This is the very much important when it comes to getting the beard transplantation done. Third mistake which I see people who get the beard transplantation done by getting implanted hair at a very perpendicular angle, or maybe near obtuse angle, you can say that. So the angle should be very much acute, or when it comes to the beard, it should be near parallel to the skin surface, which is less than 10 or 15 degree. If your surgeon has got if your surgeon has implanted the hair at a very obtuse angle, or less acute angle, the hair will go outwards, and you won't be able to manage them when the hair will grow to a length. So this is the third mistake which people usually face after getting their beard transplantation done, when it's done improperly. So angle is very much important, shape of the beard is very much important, and the plugs of single hair or plugs of 2 or 3 or 4 hair should be avoided. It should always be single hair in 95 to 98% of the transplanted area. So there are 3 important mistakes which are done when you end up having a poor beard hair transplant. Now, if you want to get the proper natural looking beard hair transplantation done, you have to get your side locks, cheek line, neckline, and the posterior line, and the mustache and goatee and chin, all areas should be covered. Then you have to respect the density of the hair in that zone. Third, the angle of implantation should be near parallel to the surface. And fourth is you have to get the single hair transplant and avoid all the plugs of hair transplant. So when you're getting your beard hair transplantation done, you have to make sure all these 4 points. The first, as I told you, the side locks or the shape of the entire beard should be in proper, from cheek line to neckline to mustache and all the regions. Secondly, the number of hair, there should be single hair, should not be like plugs of hair, 2 or 3 hair. No, only the single hair should be implanted. Angle should be very much parallel to the surface, and there should not be any visible cobblestones when it comes to the beard. There are 3 to 4 areas where you have to be very much sure about it, see the results, how their clinic are delivering the results, and is all these points which I covered are very much normal. Now, there's a role of technique here, which is very much important when it comes to the Sapphire FU hair transplant method. I already made a video in the past where I discussed how the Sapphire FU can help, because Sapphire blades, they are very sharp in nature, very small, very tiny, and when we make incision with the Sapphire blades on the face, it won't leave any marks. So when the light will come on your beard, you won't see any visible signs of scarring. Sapphire FU is good for getting the high density hair transplant without any scars. It doesn't allow any cobblestone formation as well. So all these features make Sapphire FUE as the best method when it comes to the beard hair transplant. But just not the method, your surgeon should also be very much skillful to execute the entire pattern and understanding about the beard hair restoration. So once your method is right, your area is covered and in a manner which looks more natural, the chance of getting the successful beard hair transplantation is extremely near 100%. At my clinic, we have done a lot of cases of beard hair transplantation, and I think when I see the cases where I'm doing the repair surgery as well, because they have got this done from somewhere else and end up having these cobblestones or maybe improper angle, or the shape is not proper, I really feel that this should be brought up, because these are the common things which can be easily avoidable if you're getting the surgery by certain experts. So beard hair transplantation is an entirely a different skill. It's not as similar to the scalp hair transplantation. A lot of understanding is required, and there are clinics who are doing really well with beard hair restoration, and you have to search for those clinics where you can get the surgery done in a very proper manner. Yes, after even doing everything, certain things still can happen, like PIH, the post-inflammatory hyperpigmentation, which is the discoloration of the skin after getting the beard transplantation. Whatever method you use, certain pigmentation can be there and can last for few weeks to a few months as well. In some cases, specifically in Indian skin type, where the skin is more on the darker side, and after getting any injury or any surgery, the pigmentation remains there for a certain period of time. Certain folliculitis, yes, it can happen like a boil or something, which can be easily covered by by taking antibiotic course or certain measures, which is not actually a problem with the beard transplantation. Swelling is universal. It happens after the beard hair transplantation, but that lasts for not more than 2 to 3 days. Usually it heals on its own. There's no additional care required. So whether you are getting any small folliculitis or the pigmentation issues or the swelling, everything is for a very shorter period and they subside on its own. Now, beard transplantation results, they start first, the transplanted hair, they fall first month as other hair transplantation. After third month, you start seeing the positive changes. Till 6 months, there'll be some decent growth, and after that growth will get more flourished, and within 6 to 9 months to a maximum to a year time, you get the entire full coverage of the beard. So the timeline start from first month itself, and then it will keep getting better and better till 6 to 9 months. So this is all about beard hair transplantation patterns and what mistakes you can avoid, and how to check for the natural looking results. Still, if you have any doubts related to the methods or the beard hair transplantation, you can reach out to us anytime. So all these things are very much important, and stay tuned with us. Keep watching our videos for more information, and like, subscribe. Take care. Have a good day.